With your stent in place, blood can flow more freely to the heart again, nourishing it with oxygen and nutrients. But for people with acute coronary syndrome treated with the stent, there is a risk that the blood flow can be blocked again. One reason why is found in the blood itself. Inside the blood are lots of tiny, disc-shaped fragments called platelets. These platelets are naturally sticky and easily clumped together to help form clots. Most of the time, the blood clots that platelets form are helpful. Blood clots help prevent blood loss from a cut or wound, for example. Blood clots can also help prevent germs from entering the body at the site of an injury. But for people with stents, blood clots can also be dangerous. After the stent is placed inside the artery, there's a chance that the sticky platelets can get caught on the wire mesh and bind together to form blood clots. If this happens, the blood clot may grow too big and stop blood from flowing to your heart. This can lead to heart attack or even death. That's why it's very important to follow your doctor's instructions after the stent is placed. To help prevent the blood from clotting in the stent or coronary arteries, your doctor may prescribe certain medications. These medications help to keep the platelets from sticking together and forming blood clots, and are designed to help the blood to flow more smoothly through the stent. Doctors call this type of treatment antiplatelet therapy. Your doctor likely prescribed an antiplatelet medicine to be taken along with aspirin. Aspirin is also an antiplatelet medicine, but it works differently than your prescription medicine. If your doctor prescribed antiplatelet therapy, it's important to follow your doctor's instructions exactly. If you do not take your medication or stop too soon, you are at higher risk of a blood clot in the stent, having a heart attack, or dying. Your doctor will decide how long your antiplatelet therapy will last. Do not stop taking your antiplatelet medicine without first talking to the doctor who prescribed it for you. One risk for all antiplatelet medicines is the increased risk for bleeding. But bleeding is not the only side effect of these medicines. Other risks exist too. Talk to your healthcare provider.